Folks, let's wait for our crew. Okay. I am very pleased to be joined by my colleagues here today, Senator Menendez, Senator Casey, Senator Shaheen, Senator Franken, and Senator Heitkamp. And our address is HealthCare, but we have a few other things that I'll mention. First, on the schedule. The problem the Republicans are having with HealthCare is not time, it's the substance of the bill. They can spend 2 more weeks, 2 more months, 2 years. As long as this bill continues to cut taxes on the very wealthy and hurt working Americans, the bill's going to be as unpopular as it is today. They've had 6 months on this bill, since January 4th. They haven't been able to make any progress. 2 weeks isn't going to solve their problem. The way they can solve their problem is very simple. Get rid of all the tax cuts to the rich, get rid of the cuts to Medicaid, and work with us to improve the existing system. And by the way, I have sympathy for the Republicans. If I were them, I wouldn't want to go home and face the voters either, because they're not getting a very good reaction when it comes to this bill. On the Cruz Amendment, which seems to be the latest incarnation to try and rescue the bill, let me be clear. The Cruz Amendment's a hoax. It would allow health insurers to offer junk insurance so long as it included one option that covers all Affordable Care Act mandated benefits. Separating the sick and healthy will drive up everybody's costs. Deductibles and copays will be very high, making it unaffordable. People with pre-existing conditions will be denied care. And many of those who actually need care will see their premiums go up, even those with employer coverage, because the insurers will try to make up for the problems they're having in the exchange with employer-covered insurance. My colleagues will be talking more about this, but just listen to what some of the conservatives have said about the Cruz Amendment and some of the Republicans, and you'll see what we're talking about. Okay? Finally, I'd like to say a few words about Donald Trump Jr. The emails are the end of the idea pushed by the administration and the president that there is absolutely no evidence of intent to coordinate or collude. It's now incumbent on the special prosecutor, the Senate Intelligence and Judiciary Committees to continue their investigations. Second, we need Donald Trump Jr. and other campaign associates to turn over any and all documents and electronic communications that investigators ask for. And we need public testimony under oath of Donald Trump Jr., who has changed his story repeatedly. And third, the House right now needs to pass the tough, strong sanctions bill that the Senate sent them on a bipartisan 98-2 vote. Between these revelations and the president's horrendous handling of the meeting with Mr. Putin, it's clear that Congress needs to step in and sanction Russia and be a roadblock to lifting sanctions, because clearly the president will not be tough with Mr. Putin as he should be. At every single turn, House Republicans have come up with excuses to avoid moving forward on a Russia sanctions bill. At the same time, we know that the administration and oil companies are lobbying them to water down the bill. Enough is enough. Pass the bill now. Senator Menendez.
Thank you, Mr. Leader. The problem with the Better Care Act is it isn't better care. It's worse. Tweak after tweak, millions of Americans continue to lose their insurance under their plan, and everyone else pays more for less. Now, freedom is a concept that we all cherish, but freedom to buy junk insurance and drive everybody else costs to the point that it is exorbitant and you can't afford it, that's not freedom. Freedom from fear that if I get sick at the end of the day, I'll have the insurance that can help make me well again, that's real freedom. And that's what we attempted to do in the Affordable Care Act. I sit on the Senate Finance Committee. I was there when we created the Affordable Care Act. I'm proud that 9 out of 10 Americans now have health insurance as a result of our work. But for not one moment did I or any of my Democratic colleagues on the committee or in our caucus ever believe that there isn't more work to do, work to drive down premiums, to create better results, to deal with the challenges of long-term care and end-of-life care. But every time since the passage of the bill where we wanted to improve imperfections or make it better, every time we try to operate on the patient, our Republican colleagues want to kill the patient. We can't move forward by going backward. If Republicans want to really do something about health care for the people in this country, they'll join us, as we offered them when we first created the Affordable Care Act, an opportunity they have not offered us, an opportunity we stand ready and willing to take to make health care really greater for our country.
Thank you, Bob. Senator Bob also. Casey.
Thanks very much. 3 quick points. One on the development that's arisen the last couple of days on the Cruz amendment or the Cruz policy. Look, I think it's very simple to explain it. It's an extreme step in an already far too extreme bill. And if all you care about 150 million plus Americans with employer-sponsored coverage, if all you care about is that coverage, you better pay very close attention to the attempt by Republicans to take away protections that you've had. That doesn't, of course, include people beyond that category, but maybe especially if you worry about those protections. Secondly, when I was home, I visited 10 counties. 9 out of those 10 counties where we went to schools to talk about the cuts to Medicaid and the impact on kids with disabilities in those school systems. We went to senior centers, rural hospitals, all kinds of different places. 9 out of those 10 counties Donald Trump carried very easily. And I saw and heard in those counties very high degree of concern about the bill. And I think maybe the best recent summary was captured in a headline in the Post just yesterday. This was a story written by someone from the Kaiser Health News. GOP health care bill will leave millions of kids with special needs at risk. All of the assertions by Republicans that somehow they're going to wall off or protect kids with special needs is totally debunked in this news article. And it's not an op-ed. It was on page 3. It's an analysis of the Republican bill just as it relates to kids with disabilities. Basically says maybe 1.2 million of the 4 to 5 million kids in that category are protected. All the rest, 4 million plus, are, to use the headline word, 2 words, are at risk. This is an extreme, obnoxious, obscene bill, and we should stop it.
Senator Shaheen.
Thank you. You know, I don't often correct my Democratic leader, but I have to do that today because he made a minor error. Because our Republican colleagues haven't just had 6 months to put together a health care bill. They've had 7 years and 6 months. And the Cruz amendment is not the answer. It would roll back protections for people with pre-existing conditions. It would cost more for consumers. The fact is, we could fix the uncertainty in the marketplace today if we work together. That's what the American people want us to do. One of the things we know we need to do is to address the cost-sharing payments that go out to help people afford health insurance. This administration has created chaos in the marketplace by refusing to say they're going to commit to paying those payments, and we've had insurance carriers say that's why they're leaving certain markets, because they can't count on those payments. Well, I have legislation that would ensure that those payments are made. If we were willing to work together, we could do that this week. We could address that uncertainty, and we can make sure that the American people have access to health insurance in those markets.
And Jean asked for unanimous consent to move that last week on the floor, and may do it again.
Great.
Thank you, Jean. Thank you, Chuck. Ultimately, this is all about individuals, people's health. And I had a Medicaid event in my state a little while ago, and we had 4 or 5 people talk. One of them is named Brandon. Brandon was born 15 weeks early. He weighed a little bit more, he weighed about a pound and a half. And he was taken to the Mayo Clinic. He was born in the Twin Cities. And Mayo said, we can't handle him. We can't save his life. And they sent him back to Minneapolis to Gillette Children's Hospital, where they did save his life. And his parents were told the first day is going to be about $1 million. And he was born with hydrocephalus. He had water in his brain. He cerebral palsy. He spoke at this event. He's 17. I actually don't worry about him because this is one of the most resilient kids I've ever met. But he wouldn't be here without Medicaid. He had a walker. He has gotten 37 surgeries since he was born. And all this is because of Medicaid. And what Bob Casey is true. This isn't protecting these kids. This is going to be cutting Medicaid for everyone, and states will have to figure out what they're going to do with it. And there are going to be kids with disabilities who are hurt. I met today with school administrators from Minnesota who are extremely worried about this because so many kids in their schools receive health care and help through Medicaid in their schools, including mental health. This will be devastating. And I don't think this is going to pass. I've been around the state. I'm co-chair of the Rural Health Caucus in the Senate. In Perham, Minnesota, a rural area that I'm sure went for Trump. I didn't look at the numbers, but I know my state well enough. There was a woman at this round table who was crying because her mother receives home health care, and she said if this goes through, she'll lose that. That's through Medicaid. And both my husband and I work, and we don't know what we're going to do with my mom. This is a cruel, cruel bill. And the Cruz bill, what that does is for very healthy people, they'll be able to buy a cheaper plan. Insurance companies will be able to write these junk policies. Some of them will be health savings accounts, and it'll be catastrophic. It'll work for them. But man, what this does for people with pre-existing conditions, we're right back where we started. Gene is right. Every one of my colleagues is right. Once the Republicans get done with this, I hope they can come and work with us, work together to strengthen the exchanges, which we can do the way Gene was talking about, and then address the high cost of pharmaceutical drugs. I have a comprehensive bill to do that. That's what we should be doing. That's what we should have been doing all along.
Thank you, Al.
Heidi.
Senator Heitkamp.
Thanks, Al. You might have noticed people in America are mad. And I'll tell you why they're mad. They're mad because they're scared. They're scared that their mothers in nursing homes won't get the care. They're scared that their children with disabilities will be wards of the state because they won't, as a family, be able to afford to take care of them. They are afraid that their pre-existing conditions will no longer be covered, and they'll have to file bankruptcy to stay well and to afford their insurance. They're afraid that we're going back and that we're going backwards. And when people are afraid, they're angry, it is absolutely essential that we respond with leadership, that we respond like the adults we're supposed to be in Washington, D.C.